All right, welcome to today's Explainer. We are taking a deep dive into an absolutely fascinating and honestly kind of alarming paradox that's hiding right in plain sight within modern medicine. We're unpacking some brand new data from the Global Burden of Disease Study 2023. Specifically, we're looking at elevated LDL cholesterol based on research just published in JAMA. Now, for decades, the medical community has waged an all-out war on bad cholesterol, right? I mean, we've got better drugs, much better guidelines, and way sharper science than ever before. But here's the massive paradox we're facing. Even though we might be winning the clinical battles, we are somehow losing the global war.
3,600,000. Just let that sink in for a second. That is the total number of deaths caused directly by elevated LDL cholesterol in the year 2023 alone. To put that into perspective for you, it's roughly the equivalent of the entire population of Berlin just being wiped out in a single year. That's a massive 6% of all global mortality. It is literally the second leading driver of cardiovascular disease mortality worldwide, pushing about a third of all ischemic heart disease deaths. So, despite all our modern medical marvels, this single, totally modifiable risk factor is still claiming millions of lives every single year.
Okay, let's dive into this. Because to truly grasp the scale of this problem, we actually have to look beyond just mortality. Public health researchers measure this using something called the DAILY. That stands for Disability Adjusted Life Year. Now, we aren't just talking about some sterile spreadsheet metric here. One DAILY represents one lost year of healthy human life. And in 2023, high LDL cholesterol was responsible for 90.7 million dailies. That is over 90 million healthy human years completely stolen by strokes, heart attacks, and early death in a single calendar year. It's truly staggering.
And this brings us to the ultimate data paradox. On an individual level, age-standardized death rates from high LDL cholesterol have actually plummeted by an incredible 45.6% since 1990. Basically, that means if you take a standard slice of the population, your individual risk of dying from bad cholesterol is practically half of what it used to be. Thank you, modern medicine. But the absolute total number of deaths caused by high LDL cholesterol shot up by 38.5% in that exact same time frame. So wait. How is it mathematically possible that we are getting radically better at treating a disease while simultaneously watching more total people die from it?
Well, let's look at part 1, solving the mystery, the decomposition analysis.
So to solve this mystery, researchers had to break the data down into its core drivers. The downward force, which represents things like better healthcare, improved emergency response, and clinical prevention, is pulling the disease burden down by over 41 million dailies. Medical science is doing its job, and it's doing it brilliantly. But there are two massive upward forces pushing against it. Basically, the sheer demographic realities of our planet are working against us. First, the global population is growing, which adds over 33 million dailies to the burden. And at the exact same time, the global population is aging, adding another 33.9 million dailies. Because people are living longer on average, they just have way more time to accumulate all that cholesterol-induced damage in their arteries.
Which brings us to a really sobering conclusion, perfectly summarized by this direct quote from the study itself. Advances in lipid-lowering therapies and clinical management are being outpaced by demographic forces. Basically, our scientific and medical progress is genuinely incredible, but it is currently losing a foot race against basic human biology and demographics. The upward pressure of this aging, expanding world is quite literally swamping the downward pressure of our absolute best medical interventions.
Moving on to part 2, a shifting global burden.
And this brilliantly illustrates the global landscape, showing where the highest baseline levels of LDL cholesterol were actually concentrated in 2023. Regions like Eastern Europe and parts of Asia are heavily affected right now. But what the study points out, which is super interesting, is that some of the sharpest increases in cholesterol levels are happening in countries that historically had very low baseline levels. Meanwhile, a lot of high-income, highly developed Western nations are actually seeing consistent declines in their population's average cholesterol.
But when we look at where the absolute impact lands, a pretty shocking story emerges. Over 1/3, 34% to be exact, of the global disability and death burden from LDL cholesterol in 2023 occurred in just 2 countries, India and China. Because these nations have massive, rapidly aging populations combined with shifting lifestyle factors, they are bearing the absolute brunt of this demographic wave.
Digging a bit deeper into that geographic shift, what the data actually proves is that high-income nations have experienced sustained declines in the health burden of cholesterol over the last 30 years. But in low- and middle-income nations, the burden is paradoxically skyrocketing. The The crisis is essentially moving away from the wealthiest nations and setting up camp in developing economies.
Which of course leads us to a profound socio-demographic divide. See, in wealthier nations, people have easy access to routine lipid screening and cheap cholesterol-lowering medications like statins. But in lower-income areas, that infrastructure often just simply isn't there. People are being exposed to elevated LDL cholesterol way earlier in their lives, but they face a severe lack of testing, low public awareness, and limited access to the life-saving therapies that developed nations just take for granted. And this prolonged, untreated exposure is exactly what leads to a much earlier onset of cardiovascular disease.
Which brings us to part 3, the prescription, beyond just medication.
So, facing this massive demographic wave and a shifting burden toward lower-income nations, how on earth do we fight back? Well, we desperately need to expand primary care systems and make foundational drugs like statins accessible and affordable globally. The researchers strongly advocate for fixed-dose polypills. These are amazing. They combine a statin with blood pressure medications into one cheap, easy-to-take pill that can be widely distributed in resource-limited settings. But pharmacology alone just isn't enough. We need broad public health policies. We're talking about promoting plant-based, fiber-rich diets, forcing the food industry to reformulate processed foods to strip out trans and saturated fats, and crucially, redesigning our urban spaces so people can actually walk and cycle safely.
Now, you might be wondering, hey, what about those highly advanced novel therapies I keep seeing in the news? Things like PCSK9 inhibitors or injectable RNA therapies that can just drastically lower cholesterol. Well, the researchers address this directly. While these new treatments are incredibly powerful scientific achievements, they are currently way too expensive. Plus, they require far too much health infrastructure to realistically solve this global crisis in the near term, especially in the developing nations where the burden is rising the absolute fastest. Which leaves us with this final, vital question to ponder today. As our global population continues to expand and live longer, can our healthcare systems actually outpace basic human biology? We have the clinical knowledge to defeat cholesterol, for sure. But right now, demographics are winning the war. We really have to decide if we have the global will to get the right treatments, the right food, and the right care to the people who need it most. Thanks so much for joining me for this explainer, and I'll catch you next time.